has this month been like for you? Because last year this time, you would have never thought your walk was going to be like this. So tell us a little bit about that.
Not at all. This month has been kind of a reflection of my whole year.
Mm-hmm.
So everyone's talking about breast cancer this month. I've been talking about it all year.
Right.
It's been kind of a wake up of it can happen to anyone.
Right.
And I want people to know that.
Right. So tell us why. Did you feel a lump in your breast? Take us to that part where you said, well, I need to go ahead and get a mammogram. What brought you to that? Did you feel something?
Well, actually, my mother is a 3-time survivor.
Right.
After her second bout with breast cancer, myself and my sister decided to go get mammograms. So this was my first mammogram.
Okay.
I did not expect the results, but so thankful that I went.
Right, because they found something that was considered a zero grade.
It was the earliest you could find it. It was a 0 grade. And the way that medicine has advanced, my options were, I took care of it with surgery. I didn't have to do chemotherapy. I didn't have to do radiation.
Right. Now, that's an extreme because some women said, I'll do radiation, I'll do chemotherapy. You chose to have a double mastectomy.
Yes.
Why did you do that? Was it because of your mother's history and you wanted to kind of do what you needed to do so that you won't have a recurrent situation?
Absolutely. The first thing I thought about was my 2 daughters.
Mm-hmm.
And after watching my mom go through what she went through twice, I didn't even want to take the chance. I wanted the lowest possible risk. So right now, I sit with you with less than 1% chance of getting breast cancer again.
Wow. We're going to talk a little bit more with Tracy Nicole about the things that she's doing now, having gone through breast cancer, and some really great things that have come from this. And we want to encourage you as we end out the rest of Breast Cancer Awareness Month to get a mammogram. A lot of folks, a lot of doctors are saying, wait until you're 40. My doctor has recommended 35. So we'll talk a little bit more about that when we come back, okay? It's 811 Streets 94.5. Under the age of 40 are being diagnosed now. Has it become more prevalent? And through your research throughout this year, I know you've done so much. Has it become more prevalent, especially among African-American women?
Absolutely. Definitely white women are diagnosed more. 1 in 8 women will be diagnosed with breast cancer.
Wow.
And the issue is the black women are dying more.
Okay.
More white women are being diagnosed, but we're dying more because we're not going to get our mammograms. We're not going and getting checked. And this is such a treatable disease. If you catch it in time.
Right.
It's not a death sentence.
What have you been able to do? I know that you've been inspired to do more. I know that you have your blog. You have to tell everybody about your blog. And you want to get into making clothes for women who are actually going through and recovering from breast cancer. So tell us about your blog and then what else has come from this experience.
Okay. When it happened, I could not talk about it.
Right.
It was very difficult. Of course, you were part of my circle of friends, and I pretty much shut everybody out. And that was my way of dealing with it. Well, I eventually started a blog, starting from day one of what happened, and I let everyone in to everything that happened. And I think it's important to know what happens when something like this occurs, when you get a diagnosis, what you go through. And my blog is beneaththepetals.blogspot.com. And I just share. I share the experiences and the way that I was supported and give advice. And I also feature other survivors on it.
Right.
With a background in occupational therapy, it was important to me to, one, look cute while I was recovering. But in that, I had to try to adapt my clothing to wear it when I had my surgery. Because when you have surgery, you have tubes and all these kind of things connected to you. But I still wanted to look cute.
Right.
So I actually connected with Dr. Jackie Walters from Married to Medicine and had a fashion show. And it was the launching of my actual clothing line.
All right.
And I adapted some clothing for breast cancer patients because I think when you look good, you feel good.
You'll feel better,
that has
right?
So much to do with the healing process.
Definitely. Well, we're glad that you are healed and doing what God has called you to do. in this process. And before we let you go, just tell everybody your Twitter and Instagram and all that good stuff.
I'm Tracy Nicole 13 on Twitter, on Instagram, and Tracy Nicole 13 on Facebook.
All right. Thank you so much, Tracy, for joining us and sharing your story today.
Thank you.
All right. We appreciate you. It's 8:21 back in the A. Coming up at 8:30, and we've got your ear to the streets with Jazzy McBee. Is Sierra Preggers. She's got details at 8:45 right here on Streets 94.5.